Welcome everyone. For those of you who are new to us, we will have a discussion on what we need to do in the United States to prepare you for a residency program here. For those who have been with us before, you got a chance to join us in our discussion on chronic obstructive pulmonary disease and on atrial fibrillation. In general, in the United States, we have a very big crisis with obesity, diabetes, hypertension, COPD, asthma, coronary artery disease, and congestive heart failure. These account for 65% of our hospital admissions and 70% of readmissions within 30 days. So you can see it's a daunting task for us in internal medicine to give good medical care. Hence, we need more doctors, and this is where you guys can come in to help us out. We have multiple residency programs in the United States, but even with that, the need to fulfill obligations in small areas, in rural areas, in areas that are hilled is, a big demand in the United States. So with this, these are some things. One, hopefully you can do a rotation with a doctor that has a professorship at a major institution. You don't have to be at the major institution. If you're at an affiliate institution, that's second level with an academic affiliation, that'll be great for you. Two, you want to do a rotation with someone that can do some academic teaching and prepare you not only clinically to be a good doctor, but also to prepare you for boards. These are some of the examples. Here in Chicago, we have our students that come with us. They rotate with us through the office. They get a chance to have some academic conversations. Sometimes we're going on a field trip to one of the major academic centers, i.e. Rush University, of which I'm a professor. And we get a chance to sit down and do a discussion with the residents at Rush. In general, we see our patients in the office, and we have a whole complement of every illness you could think of. We see the patients, we present them, we have an academic discussion, we have a game plan for the patient, and then sit down and talk to the patient in a manner that they can understand. We do this and have a good time in doing it. There's no pressure, there's no hassling, there's no making anyone feel bad, because the major goal is to prepare you to be a good doctor. And if we can't make you feel comfortable in doing that, you won't succeed. The other big thing I wanted to talk about is where you do your residencies, or your program before you do a residency. You don't have to have a physician with a letterhead that says Rush University. Mine says Associates in Primary Care. But after I write your letter, at the end of the letter, it'll say Cedric L. Coleman, Associate Professor of Medicine, Rush University, and we sign it with the Rush seal. So if you have a person that's academically inclined with an academic affiliation to write your letters, and trust me, in Chicago we know the other professors, that would take you far on where you want to go. The other major thing I wanted to talk about are some myths about where you should do your rotations. It doesn't have to always be, again, in an academic institution, but an academic institution with a physician in the community would be great. Because once we go and train at Rush, or University of Illinois, or University of Chicago, we don't practice there. We practice in the community. So we have to have a mind for academic medicine, but then a mind for kindness and working with our patients in the community. Because all of them would understand the big words we use when we're talking about medicine, but they do understand their language. And when we learn the language of the patient, that's more important than anything else. The other big thing that you will learn here is using the EMR system. We had to go back at Rush when we had people to come in to do our internship. We had to call them back and have them come in 2 weeks early because they didn't know how to use the electronic medical system. And with that, as an intern, your whole life evolves around you using the computer. So you get a chance to get some opportunities with that here, get a chance to get some opportunities with academic medicine, and you get a chance to sit back and be a person and to be a doctor. As you go through and do your course here, you'll see that we have a program that we work together with here on teaching you things. We have a real good website to go to where we have clinical cases covering everything from Coleman syndrome to baseniosis. We also sit down and go through these individual case presentations, which can take up to 2 hours to discuss. But after going through our conversation, we'll cover multiple areas that you'll see on boards. So again, in doing this, it's academic, it's social, it's clinical, but at the end of the day, you still have to be a person. And we try to have people do medicine to be comfortable, but yet still have a lifestyle within medicine. Now, if you go back and look at some of the reviews we've done, you'll see when we do this clinically, we sit down, we talk with the residents, we have a discussion, we talk about the literature, we talk about the clinical aspects of medicine, we talk about current literature now and future literature in the future. And one of the things that we talked about that people seem so amazed about is the cure for hypertension. Yes, I did say that. There is a cure for hypertension. People don't talk about it much. It's been studied at least for the last 10 years, and it seems like what we need to do for that to complete the course isn't very difficult at all. And granted, you don't hear a lot of people talking about it, but that's something that's going to be coming up in the future. Also, the last and most important thing is sitting down with you, preparing you for residency. We do that also. We talk to the program directors for you. We talk to you to try to tell you what your weaknesses are. We try to get you prepared to do an interview. So not only is it the academic medicine, the social medicine, but it's about you and preparing you for a program so that you can do well and be successful. And hopefully when you finish, you can stay here in the United States and help us with our need and delivering good care for all of our patients. We have a website that you'll go to that someone will talk about later that can direct you to all the different programs that we have here in Chicago. And God bless you. And if there are any questions, you're more than free to contact me in my office. Thank you so much.